In recent years, a groundbreaking proposal has emerged that could significantly impact millions of Americans relying on government benefits. This potential game-changer involves a 24% boost in benefits for low-income recipients of Social Security, Supplemental Security Income (SSI), Social Security Disability Insurance (SSDI), and certain Veterans Affairs VA benefits. As the cost of living continues to rise and many beneficiaries struggle to make ends meet, this proposal has sparked hope and debate across the nation. Today, we'll explore the details of this proposed legislation, its potential impacts, and what it could mean for you or your loved ones. Before diving into the specifics of the proposed boost, it's crucial to understand the programs we're discussing. Social Security, established in 1935, serves as a cornerstone of financial security for many Americans in their retirement years. It provides a steady income stream based on an individual's work history and the age at which they begin claiming benefits. Supplemental Security Income, or SSI, offers financial assistance to adults and children with disabilities who have limited income and resources, as well as to people 65 and older without disabilities who meet specific financial criteria. Social Security Disability Insurance (SSDI) supports individuals who have worked and paid Social Security taxes but can no longer work due to a medical condition expected to last at least a year or result in death. Lastly, Veterans Affairs VA benefits encompass a wide range of services and payments for U.S. military veterans and their families, including disability compensation, pension programs, healthcare, and education benefits. While these programs provide essential support, many recipients find that their benefits fall short of providing a comfortable standard of living. As of 2024, the average monthly Social Security benefit is about $1,907, while the maximum federal SSI benefit for an individual is $943 per month. SSDI benefits average around $1,537 monthly, and VA disability benefits can range from about $165 to $3,823 per month for a veteran without dependents, depending on the degree of disability. For many, these amounts barely cover basic necessities, especially given the rising costs of healthcare, housing, and food. This financial strain has led to increasing calls for reform and more substantial support for beneficiaries. Enter the Social Security Expansion Act, a piece of legislation introduced in Congress that proposes a 24% increase in benefits for long-term recipients. This act includes several major changes aimed at improving the financial security of beneficiaries. First and foremost, it proposes a 24% increase in the primary insurance amount (PIA) for all beneficiaries who have been receiving benefits for 20 years or more. This change recognizes that long-term beneficiaries are more likely to have exhausted other resources and face higher healthcare costs. The act also suggests increasing the special minimum benefit to 125% of the federal poverty line, ensuring that no one who has worked for decades falls into poverty in retirement or disability. Another significant aspect of the proposed legislation is a change in how cost of living adjustments (COLAs) are calculated. The act suggests using the Consumer Price Index for the elderly CPIE instead of the current CPIW. This shift is important because the CPIE specifically tracks the spending patterns of older Americans, who typically allocate more of their budget to healthcare and housing than the general population. By using this metric, annual benefit increases could more accurately reflect the actual cost increases that seniors and disabled individuals face. To fund these substantial improvements, the Act proposes gradually eliminating the cap on taxable earnings for Social Security. Currently, Social Security taxes are only collected on earnings up to $168,600 as of 2024. By removing this cap, high-income earners would pay Social Security taxes on all of their earnings, significantly increasing the revenue flowing into the Social Security trust funds. This change is designed to ensure the program's long-term solvency and make these benefit increases financially feasible. The potential impact of this 24% boost cannot be overstated. For millions of Americans, such an increase could be truly transformative. It could lift a significant number of seniors and disabled individuals out of poverty, reduce reliance on other social services, and stimulate local economies as recipients spend more on goods and services. With increased benefits, many recipients could afford safer, more comfortable housing, or be able to stay in their homes as property taxes and maintenance costs rise. The extra funds could mean better access to necessary medications, medical equipment, or preventative care that might currently be out of reach. Food security would improve, with beneficiaries no longer forced to choose between paying bills and buying nutritious food. Moreover, the reduced financial stress could have significant positive impacts on both mental and physical health. However, as with any major policy proposal, the Social Security Expansion Act faces challenges and criticisms. The primary concern is the cost. A 24% increase in benefits would require a significant increase in funding for these programs. Critics worry about the impact on the federal deficit and national debt, arguing that without careful planning, such a large increase could strain federal finances. Some also express concern that such a substantial increase might reduce incentives for private saving or working longer, though studies on similar policies suggest these effects are usually small. The path forward for this proposal is complex and uncertain. To become law, the Social Security Expansion Act would need to pass both houses of Congress and be signed by the President. This process would likely involve extensive debate, possible amendments, and negotiations between different political factions. The timeline could stretch over months or even years, and the final version of the law, if passed, might look different from the initial proposal. The likelihood of passage depends on many factors, including the makeup of Congress, the economic situation, and public opinion. While there's broad support for improving benefits for low-income recipients, the specific approach and funding mechanisms are likely to be points of contention. For those interested in supporting this proposal or staying informed about potential changes to these benefit programs, there are several steps to take. Staying informed is crucial. Reliable sources include the Social Security Administration's website, reputable news outlets, and nonpartisan policy research organizations. Contacting your senators and representative to share your thoughts on this proposal can make a difference. You can find their contact information at house.gov and senate.gov. Joining advocacy groups like ARP or the National Committee to Preserve Social Security and Medicare can provide updates and opportunities for action. Participating in town halls and public forums allows you to learn more and make your voice heard. Lastly, while following potential changes is important, it's crucial to have your own financial plan. Consider consulting with a financial advisor about strategies to supplement your benefits. In conclusion, the potential for a 24% boost in benefits for low-income Social Security, SSI, SSDI, and VA recipients represents a significant moment in the ongoing discussion about social safety nets in America. Whether this specific proposal becomes law or not, it has sparked important conversations about the adequacy of our support systems for seniors, disabled individuals, and veterans. As our population ages and faces new economic challenges, ensuring the financial security of our most vulnerable citizens will remain a crucial issue. By staying informed and engaged, we can all play a part in shaping the future of these vital programs and working towards a more secure future for all Americans.